Dear friends, I am Dr. Thompson, Akwo, Ntuba, international political leader, international physician, international communicator, international communicator in religion. Global health. Global health. The modules that I teach, the workshops, the conferences and seminars on global health, are about 7. First, I have a chunk of series and teachings on global health definition and how we measure global health, whether we are using DALIs or QALY or mortality rates and all the other rates. Is tied down to the definition. In the definition, I try to teach my students, whether they are in the universities or they are in institutions or in conferences or in the workshops or, when they come for the meetings, the seminars. I try to make them to have an understanding that the definition of global health is a work in progress. But as I use global health conditions like HIV/AIDS and SARS-CoV-2, COVID-19, then they get to understand that people in all the continents are affected by this health condition, or people globally. That is to say, in the whole globe, the whole continent of America, South America, North America, Europe, Eastern Europe, Western Europe, Asia, the East, the West, the Middle East, and the Middle Eastern part of Africa, North Africa, the Sub-Saharan Africa, South Africa, and name them. They are all affected by global health conditions like SARS-CoV-2. As a certified communicator of member states of the World Health Organization, certified by the World Health Organization, I have had the singular blessing and opportunity to work with the leadership in Geneva. And we had the times when it was Dr. Chan, Margaret, and a lot of the work that was done, and then the other leaders who have come later. The bi-weekly meetings with the Director General, the conferences, the workshops, the seminars, and SARS-CoV-2 during the times of the initiation of the ACT Accelerator and the other instruments at the level of the United Nations Health Agency that is called the World Health Organization. I said that to say that global health, as I've told you, some of the health conditions that we deal with, that we are involved in policy, promotion, protection, healing, and development issues, have to do with the whole people of all the continents. They have impact, economic impact, that is global. They have political impact that is global. They transcend national boundaries. And as I said, those issues have a multidisciplinary approach in the way that we have tackled them. As physicians, we have had to treat HIV/AIDS patients. I've treated HIV/AIDS patients in multiple countries around the world. I've been in international conferences. I have worked with the international AIDS conferences with all the certification of my work. I have had to work with the International HIV/AIDS Conference in Washington, D.C. And just to tell you how much work we have done in HIV/AIDS, I've had to travel to France with the Cameroon government through the health leaders in certain places, actually writing through the French embassy in Cameroon or consulate in Douala to the government that I am going to Toulon for the International HIV/AIDS Symposium, and that I have been working in HIV/AIDS, and there's a lot of resources that I carry around the world. I think that was very good. It was a great recommendation. It was a great paperwork that was given to the French government through their embassy, and that was an opportunity for me to have that opened the doors for multiple entries for me to France. And in the HIV/AIDS work that we did in Toulon with Dr. Anthony Fauci, and I remember the discussions I had with Dr. Anthony Fauci in Toulon and all of the other French experts in HIV/AIDS. So it wasn't only France, it wasn't only England, it wasn't only China, it wasn't only India, it wasn't only Japan, Korea, Russia, Brazil, Argentina, Mexico, Canada. But all the little island nations, the Bahamas, Jamaica, and the others that are also affected. And we have island nations, in other parts of the world. So, in a nutshell, I haven't given you the definition of global health, but I've situated global health in this explanation for you to be able to understand, so that when I give you and I teach you on the definition, then you get to understand. Then the other module that we teach in global health, or I teach, is infectious diseases. Now, I've had the opportunity of, one of the things that I did in my professional career as a physician, as a registered MD in multiple countries, is that I had an opportunity of working in a teaching hospital as a senior medical officer. And working in a government teaching hospital, and I repeat, a government teaching hospital in an African country, was an opportunity for me to be able to have the experience of how government is involved in healthcare delivery to the people as a professional, as a chief medical officer, as a senior staff medical officer. We had the opportunity of looking at different health problems, and I worked at the pediatrics ward, and covering the emergency as a senior staff medical officer. A lot of the cases that I saw first was pediatric cases, whether they were neonates from the first day to the end of the month that they were born, or the first infants in the first year, or cases in the 5 years, that we're very particular about, with infectious diseases predominantly being one of the major killers. We had diarrhea, different forms of pneumonia that we're very particular about, and the way we took care of that medically as a physician was pretty great. But the same issues, that I'm talking about are being faced in China, in India, in Europe, in America, in Colombia, in South America, in many of these countries. That's global health. So child health and survival is pretty very important. And we're looking at nutrition and problems related to diet and nutrition. We had marasmus, kwashiorkor, marasmic kwashiorkor, and all of that. And when we talk about working in the labor ward, taking deliveries, doing antenatal care, working with the women on their immunization, and then postnatal care, counseling them and the babies that they brought, how to make sure that they did not only have their own vaccines, but they were also given following the schedule according to the national vaccination programs of the nations that I work, to vaccinate their children at the different phases of child development, or stages or milestones of child development, and then advising them on child nutrition, the importance of nutrients for a child as they were growing up. That is a lot of what was done, including advice on reproductive health methods, and some of those reproductive health methods advice had to do with making sure that beds are spaced, right? That if people space their beds enough, then they have enough time to be able to do other things and to regulate their families and take care of themselves properly. So, doing labor ward work, taking care of babies, working in the ICU or neonatal intensive care unit with other physicians, gave me the opportunity to ground my global health work under maternal and reproductive health, child health and survival. With maternal health, we had programming, and we continue to have programming and to advise on programs that help women, especially women who suffer from postpartum hemorrhage. We basically were not only teaching them on how to make sure that they can come in when they begin to see certain signs, whether it was in the first trimester of gestation or pregnancy, or second trimester or the third trimester, but what to look for if they were bleeding, per vagina in the first trimester, that is the first 13 weeks, or the second trimester between the first and the 26 weeks, or the third from the first to the 39 weeks. And then we have an idea, because if we broke it into 3 13 weeks period, then we know which trimester of the 3 had a problem, or they had a problem in. That notwithstanding, there is programming for women, especially in what we call LMIC, low and medium income countries, so that we can take care of maternal deaths related to pregnancy. So whether it was preeclampsia, eclampsia, diabetes in pregnancy, high blood pressure, other health-related problems that will complicate the pregnancy. And then we were always getting ready to see if the woman would deliver per vagina or would do a cesarean section, whether it was a horizontal or vertical section. It's not what I'm talking about now. But the fact that there are certain conditions under which a cesarean section should be done, else you actually put the life of the woman or the pregnant woman in danger, and also the life of the fetus in the womb or uterus. those programming are done in a way that resources are mobilized, especially in LMICs, to be able to put facilities in place to take care of some of these things I'm talking about. That is global health. In a nutshell, as it relates to maternal and reproductive health, child health, and survival. Then we have infectious diseases. And I already alluded to some of the infectious diseases we have been dealing in global health, whether they are parasitic diseases, or they are fungi diseases, or they are bacteria, be they gram-negative or gram-positive, whether they are affecting the central nervous system. You hear about meningitis, pneumonia, related bacteria that will cause pneumonia and cause meningitis, whether they are gastrointestinal issues. And one of the problems that we try to address fast and early enough is that it's diarrhea in childhood, because the major thing you're afraid of is dehydration, and then they will go into shock. And when that happens, they may not be able to come back or be resuscitated. So you want to hydrate properly. You want to look at whether it's salmonella, it's shigella, or whatever is causing the diarrhea. There is the problem of diarrhea. Those are some of the major issues, which are addressed within that context, and global health programming done in that way. There are lots of people who have been asking, we have the problem of HIV/AIDS, human immunodeficiency virus, and AIDS. That has been one of the major global health problems, which is known around the world. Every nation, every continent, even though in different degrees, is affected. And when the immune system is depressed, as the virus is set to do, then it exposes you, to things which normally shouldn't pose a problem. So the HIV/AIDS patient is predisposed to certain cancers, Kaposi sarcoma, which is a form of bone tumor, which normally shouldn't be there frequently, but in that community we see that a lot. I have been working with the LGBT community, and there are certain statistics and data that shows that relatively HIV/AIDS is higher as a group, as a community. And putting all the judgments, morality issues by the side, we go in there as global health experts to look at what is going on. We look at the data, and we want to be influenced in our decision making by the data that we have. So you could talk about population health in that respect, and talk about global community health, and we go to that is a population. There is another population, the prison population. There is another population, the school and campus population. And we will continue to tell you that global health practitioners like me are also looking at the module of what we call environmental, climate, and migration. I have worked a lot with the big oil companies around the world. I've been working with CERAWeek. That's one of the biggest executive energy conferences around the world, working with the big government ministers and prime ministers and name it of nations, Middle East, Unfortunately, we lost our brother, the former OPEC chair president, Bakindo. We had Bakindo in CERAWeek a number of times as the CEO of OPEC, and the last time we heard from Bakindo was at the World Petroleum Congress. The World Petroleum Congress this 2023 is in Canada. The issue of CCUS or CCS, carbon capture storage or carbon capture and utilization, is being discussed. We know the problem of carbon dioxide and then also methane and other greenhouse gases that are contributing to global warming and creating climate changes that are having climate environmental impact on humans and human environments, house destruction, tornadoes, and all of those things. And then we also see the problems of migrants who are victims of, natural disasters and some of those climate change impact on the environment, and they're running from place to place. Some even is from countries to countries, and they come up with all sorts of, health problems because they are in camps. They are addressed in a particular way also. And the other module that we discussed is food and water. I've been part of the Texas Water WEF, the Water Environmental Federation conferences, the nutrition conferences, the diet conferences. As an international expert and certified professional expert in global health by Johns Hopkins and USAID, subspecialized in global health communication and promotion, I get to do a lot of global health communication or health and medical journalism somehow to be able to inform, communicate, and educate, as I have been doing over the years. We've worked, as I said, extensively in the energy capital of the world with most of these companies, Shell, Chevron, Aramco, name them, and I am telling you that this work has been ongoing. We've also been working with the NACCP, the Congressional Black Caucus, the Congressional Hispanic Institute, looking at equity issues in health. We've been to Morehouse School of Medicine in Atlanta, Georgia, Grady Hospital, for some of these issues. Our travels have been extensive, and I am very grateful to our partners. It has been much. And then I want to lay emphasis on health systems and governance. I have worked with the American Medical Association, worked with the nurse executives. We've been part of lots of programming here and there, and these programs are meant to be such that people have an opportunity to be able to contribute so that there's a positive output based on what we are doing. So in global health, the health systems and global health governance is very, very important, because if we look at health finance, infrastructure, insurance, delivery of care, and how it is done and organized, human resources in healthcare and the different categories of personnel. In the US, we have nurses, nurse practitioners, nurse aid licensed nurse practitioners, physician assistants, physicians, all types of people in the healthcare. And then also the work we've been doing with those who are involved in biotechnology. Professor Russell, who is a guru in robotics, and all the others who are doing work in imaging and all of that. You are all part of the healthcare industry and making a great contribution. Your contribution in global health is very, very important. And so when we talk about global health infrastructure, those who design hospital systems, their buildings, and other things have a lot to play. So this is, in a nutshell, the introduction of global health conferences and seminars that I do around the world. And I particularly come in and discuss them in detail when I come, but I always want to give this to people. When we talk about global health governance and policy, we've worked in Washington, D.C., and worked with Matthew Bowell, of Barack Obama's Minister of Health, and then Governor Sibelius and the others. And then when we meet At the World Health Assembly, as an international communicator in global health, we get to put the contribution of the United States, China, Europe, African countries, Asian, South American countries together, and then communicate the resources and give them to member states and to others.